Welcome to episode 32, Lynchburg DMSC Pulse of the PA podcast. Today we have Dr. Valerie Stern here, who is a dermatology PA and alumna of our University of Lynchburg DMSC program. Welcome, Dr. Stern.
Thank you so much, Dr. Rolfs. It's a pleasure to be with you today. I'm actually really excited to be here and looking forward to this time.
Well, we're so excited to have you here today. We also have Dr. Kilgore with us as well. I think we'll get started and just have you give us a little background about yourself in terms of your career as a PA, why you decided to get into the PA profession.
Yeah, absolutely. Well, honestly, way back in the day when I was an undergrad at UCLA, and I was a psychology major. And I really enjoyed it. And I truthfully thought I would end up becoming a psychologist. And I did a rotation. It was one of my longer rotations through my degree program, where I went out into the field and worked in psychology. And I did it at the Venice Family Clinic, which is a clinic for low income, no income individuals. We have a homeless clinic, and we just served a great population within this clinic. And I acted as a medical assistant there, and then also really just did anything and everything they needed me to do while I was doing my work there. So we had a domestic violence clinic. So we would have a lot of the parents maybe coming to take part in that. And I might sit with the children and help them or read to them or do whatever while their parents were doing other things. And I remember one day, one of the doctors needed somebody as a medical assistant in the clinical aspect of work. And they said, Valerie, we need you. So I said, okay, but I was a little nervous. I wasn't sure if I could handle it. I didn't know if, blood and medicine and all of that was going to be for me. And it actually motivated me and inspired me. And it was probably that week when I thought, wow, do I want to do psychology or do I maybe want to look more toward medicine? And so I continued to do my 6-month externship or whatever you want to call it with UCLA. I was there for 6 years at the Venice Family Clinic. And at that point in time, I decided I was going to take the medical route instead. So I had a small child at the time, and I decided to look into different medical professions, and PA just stuck with me. It was the best of both worlds. It was something that I could do with a bit of autonomy, but at the same time I could do as a team player. It was a way to learn and to work with others, but it was also a way for me to take pride in being the caregiver for those patients as well, and bring my own personal way of doing things to them also. So that's where I focused. And I was fortunate. I applied and I was accepted. And so I ended up graduating from USC Keck School of Medicine Physician Assistant Program back in 1997. And it was one of the best experiences of my life. It was a lot of hard work, as you all know. It's not an easy program when we condense all that we need to learn into the short months that we have, but very, very worth it. And right out the door, I had many job offers as a student, which was something that was surprising, but was actually really nice to see. And my heart was set on emergency medicine and working through the USC or the LA County. So I started off in emergency medicine in the jail ward at the county facility at the time. And I loved it. It was just so exciting, rewarding. I learned so much, and I had such a great group of mentors with me, both physician assistants, medical doctors, as well as the nursing staff and so forth. My big transition came when, of course, my student loans came due, and I didn't really realize exactly how far that money was going to go. When you finally graduate and then your first paycheck and you see how many dollars you receive and how many went to income tax. So a second job was in the works. And I actually ended up getting through college as a cosmetologist and an esthetician. So that's how I got through my undergrad work. So I found a job in dermatology, and this was back in '98. there weren't a whole lot of us physician assistants in dermatology. And I really didn't think they would even want me because I really had no experience. But I applied, and the group that I happened to join, the head doctor was a wonderful medical doctor that both enjoyed dermatology as well as teaching. And I thank him to this day. Because of him, I'm where I am today, to be quite honest with you. But he took a chance on me, and I was able to spend a lot of time not only with him, but with the others practicing at his facility. So there were six of them, and they were all genders, they were all ages, they were East Coast trained, West Coast trained, and everything in between. And it was quite nice because I was able to learn from six dermatologists and see that there isn't always just one way to do certain things, and spend time with them and learning from them. And my passion took over, and I really felt that that was where I wanted to be. And so I stayed with the county ER in jail ward for about 3.5 years, and then I transitioned into dermatology full time. And I think one of the main reasons derm was so intriguing for me was we all have skin, number one. And the cases are different. It's very procedural oriented, and you get to know your patients well. It's not like the ER where maybe they come in with pneumonia or a broken bone and you may never see them again. My patients I know really well. I might see them for 10 years or see them throughout their acne journey or their wart journey or something along those lines. I get to meet their family with them, so I get to know them each month and so forth. And I think one of the things that was most exciting or warming my heart was when a little 7-year-old referred another little 7-year-old to me to have their warts removed. And, I told them it's going to hurt, but their little friend still wanted to come in because she's like, oh, you'll like her. She's going to hurt you, but you'll still like her anyway. So they didn't really like the procedure. But, when you get little letters from them with a picture of them in their school or their pets or whatnot, it's like, okay, this is why I do what I do. And it just melts your heart. So that is really where my journey in derm started, and really started to just go from there. And I then went on to get my master's degree, because at the time when I did my physician assistant work, it was still a bachelor's level. So I was actually born and raised in Nebraska. And so I did my master's work through the University of Nebraska Medical Center, sort of as a little tribute to the fact that that's where I was born. And I did it with an emphasis in dermatology and really enjoyed that. And then after I did that, again, continued to work in derm. I also began to lecture and work with a couple international laser companies and one pharmaceutical company, lecturing and training their individuals and so forth. And then some years thereafter, I was contacted about doing expert case testimony with regard to advanced practice providers, which of course back then you didn't see a lot of. And of course, with more of us, obviously there's going to become a situation from time to time where legal aspects take over. So I began acting as an expert in testimony in dermatology for cases that involved advanced practice provider on either side of the situation. So that was interesting. I don't know that it's fun per se, but it's very interesting. It's challenging, but it was also and has also been extremely rewarding. So during all of this time, this is just basically where my career went. And as I became a bit older and so forth, I started to wonder about my future and what ifs, and, what if something happened and I couldn't work anymore? What would I do? And I'd also been a teaching, I'm not on faculty at USC, but I teach there every year. I would teach dermatology didactics, and then I did the clinical skills course for the students as well in dermatology. And so I've been there for quite some years. And I thought, well, education is something I also love. So maybe I should look at, moving forward with my education so that I could take on a more academic role in the future. So I started to look into that, and there weren't a lot of programs. Actually, when I first started looking into it, there weren't any programs. So it was a different type of a degree that I could still obtain, but it wasn't really a degree designed for physician assistants. And then, sure enough, some years thereafter, Lynchburg came about, and I was able to take a look at Lynchburg's program as well as a couple of others. And I was so impressed by the program. And I will say, I was also thrilled because it was a program I knew was going to be intense, but I also knew that I could devote the time to it. Sometimes you don't know how many years you're going to be able to have. And I knew I could find the time and I knew I would be able to get through this. So I decided, you know what, there's no time like now. And I decided to look over the application, spent some time doing so, and decided to go for it. And that was 2018. And I graduated from Lynchburg's DMSC program in 2019 with my Doctor of Medical Science in clinical medicine and dermatology. And then I went on and did my doctorate in PA academics because I knew that teaching was something that I would want to pursue. So I decided to do both the clinical aspect of the doctoral degree as well as the academic. And since that time, I continue to teach at USC. And I've also taken on another passion of mine, which is integrative medicine. And I've been able to take both the integrative medicine world as well as my dermatology background in a program that's called Learn Skin, which is an online academic program for integrative dermatology. And the beauty in this program is that it's not just designed for board certified dermatologists. It encompasses and incorporates every practitioner out there that works with skin. And in doing so, we take both an Eastern and a Western approach to how we treat our patients, and we provide them with just an awesome, wonderful, integrative uh, way of looking at their disease state. So I'm now director of the program, which is called the DCIE, which is the Dermatology Clinical and Integrative Essential Program for non-core dermatologists. So it includes our physician assistants, our nurse practitioners, our doctors, maybe in internal medicine, pediatrics, family medicine, or wherever, as well as naturopathic doctors, acupuncturists, chiropractors, nurses, just any dietitians, psychologists, anybody that relates to skin in their practice but wants to learn a little bit more and wants to add an alternative component to the care that they provide. And I think the thing that's nice about Learn Skin in the integrative model overall is the fact that we have a lot of patients out there asking for it and looking for it online. And we now have a solid program that can bridge that gap and give them research-based, integrative quality literature to help back up why we use what we use when maybe somebody would prefer this over a more allopathic model, or maybe if the allopathic model isn't working for them. That brings us here today.
Awesome. That's wonderful. I mean, you've done so much in your career, and it just seems like you're continuing to be innovative in the dermatology field, especially with Learn Skin. Dr. Kilgore, do you want me to start off, or do you have a question in mind? Okay. All right. Well, my question for you is, now you discuss how you ended up pursuing your DMSC degree, and I would just love to get your thoughts on our profession and moving towards the doctorate, and really what the DMSC has kind of been for you post graduation. Like, do you see that it's opened up doors for you? Do you see that it's really allowed you to kind of be in that parity with your other healthcare providers in your field? really honestly just want to get the DMSC point of view from you.
Sure, absolutely. You know, I think the DMSC program is amazing. I think it's amazing not only for new grads, new PA grads that want to carry on into this program, but I think for people like myself that graduated quite some time ago, it's also equally wonderful, if not more so, because it's a refresher in a sense too. But what you learn from this program is so much more involved. I mean, let's just stop and look at things like I had mentioned, I work as a legal case expert. We have a whole medical legal course in the program, the DMSC program. And what I learned throughout that program, I use every single day, and it just reinforced everything I did prior and everything I'm doing now. I might get a case, and they might email me and say, "Hey, we've got this case. Will you take a look at it and give us your opinion?" I now know exactly how to write that case up. And I also have that knowledge base from my DMSC degree program that I can bring to my work with them. Also, I think it lends support to the fact that we have this advanced degree and I don't want to say, we command respect, but I think when you do go out if I have to go to the courtroom or whatnot, let's face it, it does make me look, it adds a bit of respect to you in your education. I don't necessarily make more money because I have the DMSE behind my last name, so to speak, but I didn't do it to make more money. I did it because it was a way for me to branch out, a way for me to add to the degrees that I had within my physician assistant work, but also to um, show that I do have an advanced educational status with regard to what I've been doing. We don't get a residency per se or anything like that. So we're sort of on our own. And when we add to it with this, I think it also levels the playing field somewhat because our nurse practitioner colleagues have a doctoral program. And we also have, depending upon the state that you're in, our governing bodies govern physician assistants a little bit differently as to what's considered how autonomous you can be within practice. And so I think when you look at that, we definitely need to be competitive. And in order to remain competitive, we definitely need this. But I also think, too, that if you do have a desire to be in academics, I think it's important because what we take from our PA education is quite clinical, which is expected. That's our goal. But education is a whole realm of its own. And having this advanced degree and this advanced education that you can bring to the table just adds so much more to how effective you can be as a leader in teaching. So, from my standpoint, because I enjoy both the clinical aspect as well as the educational aspect of it, it was truly something necessary for me to move forward. And then, of course, with the integrative dermatology group, it's made a difference there as well.
So, Valerie, you touch on a couple of issues, and one I'm going to ask you about is that I've been a PA for a long time, and I've been active with AAPA and our other four orgs quite a long time, and very aware of politics, and also aware of the impact that specialty organizations have. I think most people know that the AMA only represents about 25% of the PA of the MDs and NDOs in the country. And to a large degree, the AAPA sort of has the same situation. AAPA probably represents about 35 to 38% of the PAs, and then if you add in the students, another 15,000, get added on top of that. But a lot of specialty organizations now represent more closely the specialty PAs. So I know you're a diplomat in the Society of Dermatology PA. Can you tell us a little bit about why that's important? We talked a little bit a week or so ago about some of the things that dermatology PAs were doing, but why is it important to you, and why do you think that role in providing education, why getting advanced degrees, why being involved in those organizations is so critical to the dermatology PA moving forward, which the dermatology PA is playing a very significant role in the profession across the board in the country?
Yeah, thank you, Dr. Kilgore. I agree with you completely, and it's a very good question. I've been part of the SDPA for many, many years. Of course, I've been in dermatology since 1998, so it's been a while. And back when I first started out, I was probably one of the very few in dermatology in the state of California anyway. And I was fortunate in that I was trained on the job. They did about 18 months with me, these 6 different dermatologists, where they pretty much ran me through everything and kind of gave me a little bit of an internship and a residency. So I was fortunate. However, the average person that steps out of school once upon graduation, if they have an interest in dermatology, where do they go to get training? Number one. And that's a really good question. Now, it's a little bit easier today because dermatology PAs, there's quite a few of us. And statistics show as well that when you look at even family medicine, approximately 30% of all family medicine chief complaints center around skin. So when you look at this, your average family physician or family PA or practice has to know dermatology. So they too are dealing with asthma, diabetes, broken bones, and whatever else. But now they've got dermatology thrown on top of it. So they don't have that specialty skill. We didn't get trained in it. So the SDPA helps to bridge that gap in a sense. Now, one thing about the SDPA that I'm actually I'm a member of the SDPA, but I also sit on their volunteer committee for the SDPA Diplomate Fellowship Program, which I actually really enjoy as well because it's kind of a way to learn why it's set up the way it is and how we bridge that gap for PAs. I'm actually mentoring somebody right now a little bit. She's a new graduate from the program where I teach, and she's going into dermatology. And she's finding it very difficult to get a job because she has no experience. Now, one of the problems, though, with the SDPA Diplomate Fellowship Program is that you have to have so many hours and whatnot in order to do this. So you don't have to have too many hours to join the SDPA, but what you need is to have a board certified dermatologist as your preceptor. Many of these individuals out there today do not have this. They're in family medicine or they're in urgent care or something like that, but they're still seeing shingles or rashes or whatever. So I know that the SDP is looking at that right now as to how we might, work on that. But if the student, or I'm sorry, not the students, if the physician assistants that do want to join the SDPA can can get can join the SDPA and then do the Diplomate Fellowship program, then they can gain some valuable knowledge that will help them to get their foot into the door in a dermatology practice. And doing so will be wonderful for them. But the Diplomate Fellowship program is a very comprehensive entry-level dermatology program that goes over all of the basics and really helps you hone in to the things that you're going to need to know on a daily basis and how to go about doing them. And just a good algorithmic way of practicing when you're in the dermatology clinic. So it's a nice stepwise program that allows them to gain a little bit of information. So I know in my case, the Diplomate Fellowship program didn't exist when I first started in derm, but of course I took it anyway. And people are like, why would you take it if you've been in derm for so many years? Well, I like learning anyway. And it also reiterates a lot of things. And it also helps me to remember things that maybe I don't see as often. So I completed it, and now I completed the second version as well, just because I wanted to stay up to date with it. The NCCPA now has what we call the CAQs, the Certifications of Advanced Qualification, and they recently added a dermatology. And that's another avenue where you can gain some experience and you can add that to your resume. So that might actually help you in landing the job that you're looking for. However, the CAQ through the NCCPA requires you have, I don't recall, it's either 2,000 or 4,000 hours worth of clinical work in the specialty for which you're doing the CAQ. So that isn't something that's going to really work for a new grad that's wanting to start in derm and use that as part of their qualification to get that job. So they need to have an in somewhere, and the SDPA is that in. They can join the SDPA and they can learn, from the SDPA. And then, of course, finding a way to do the SDPA diplomate program would be another step. I have found that it has helped me tremendously, just like our doctor colleagues, our MD and DO colleagues in dermatology, for instance, they have their AAD, their board certification through the AAD. And I can add to my title, Valerie Stern, my credentials, and then SDPA Dermatology Diplomate Fellow. So it adds support. It gives me a little title in a sense. And I think from a patient standpoint too, they feel that I've really taken the time to advance my education and my career. And I've done so for them as much as I've done so for myself.
Great. So let me jump for this a minute because I want you to answer another question, and I don't know if Ross will want to jump back in. But obviously, I acquired some additional certifications, obviously in mental health, behavioral medicine, also obesity medicine, et cetera. There are some other programs out there that you can add credentials to your name. But I know in my discussions with some people across the country in particular about the issue that you mentioned, more autonomous practice, some of the physicians that have been very adamant about this have thrown numbers out at me, 4 to 8,000 hours, 2 to 4,000 hours of experience before you can become more, quote, independent, even though I'm not sure any of us are really independent today. But they throw these numbers out, and I've always asked the question, why do you pick 2,000 or 4,000 hours? I said, well, that's the equivalent training that a physician would receive in a residency or fellowship. So backing up, I get a lot of people ask me about dermatology. What do I need to do to be successful? So I know we mentioned earlier there are some programs that you can go through to learn that you may want to expound on. But if you were giving somebody advice and you put it in a nutshell, you need experience, but you might need to get these certifications or go through these training programs to add to your clinical skills you got as a PA to really be competitive. What would be your advice? I mean, what programs out there are people really needing to take a look at to be successful to move over into dermatology? Or since I'm in behavioral medicine at the moment in that concentration in the doctoral program, I tell people everybody has to do behavioral medicine or mental health in practice. And I'll agree with you 100%. I probably need to know as much dermatology as you do because I see it every day in practice. I can't put steroids on everything. So there has to be some level of education. So what do you recommend and what are the best programs for people interested in dermatology?
Sure. I have to just say one thing quickly. You are so incredibly correct, Dr. Kilgore. Psychology, psychiatry, and dermatology are like this. I mean, derm and rheumatology, allergy, immunology, and so forth, yes, but psych. I'm actually a member of the North American Neurocutaneous Psychological Association, and I'm actually in the midst of speaking with somebody there right now and trying to attend their conference at the AAD next month. There's a huge, huge amount of psychiatry or psychology that goes into derm. There's no question. There is derm that creates psychological issues, and there are psychological issues that create derm problems. And they are hand in hand. And we at Learn Skin through the DCIE program, we are actually going to be doing a webinar on psychocutaneous dermatology very soon. And I would love to talk to you further about that because I think it's an area that maybe doesn't have as much acknowledgement or whatnot, but it's there and it needs to be thought about. And when you do look at that and you do think about it, things happen and it makes a difference, and patients acknowledge this. Back to your original question, though, where can students, or not students, but where can new PAs go? That's a good question, and that is a difficult one because most programs do require that you're either with a board-certified dermatologist to join their program, or they want you to have X amount of hours before they'll allow you to sit for an exam or whatever. So this is difficult. However, what I would suggest, and this is something that I've found that I've done throughout my career, I have always called around and said, hey, this is who I am. This is what I want. Would you be willing to take me in? I will work for free. I will come in and shadow you every week, 1 day a week or whatever, for X amount of hours until you get to know me. And then maybe we can work something out, or maybe you can refer me to another practice. That was something that I did a lot of. And my pharmaceutical rep friends were my best allies. They really helped me. I might say, hey, I really want to gain some more experience. I love where I'm at, but I'd really like to learn more about this. And they might say, well, you know what? I've got this great office in this city. Why don't I talk to them and see? And when you work like that, sometimes they'll say, you know what, sure, send them in. We'd be happy to have them come in and shadow 1 day. And then that can turn into more and more. I'll be honest with you, my ultimate goal right now is to create a program where we can train our fellow PAs derm. I do what I think is an amazing job. Not to say I'm amazing. I'm not amazing, but I think the job that we do at USC and giving them the clinical education during the program is wonderful. And even though they do not have experience per se, they have the luxury of having a 10-week elective where they can do dermatology on top of the didactic derm they've learned, on top of the clinical skills program that we've created. And we train them on doing shave biopsies, punch biopsies, excisional biopsies, curettage and desiccation. We teach them all of this, and we have them going through the motions and actually doing the work, to where when they get on their rotation, they are lucky in some respects to where they're able to do these things. So they can put this on their CV or their resume right off, and it shows that they've got a good 3 to 6 months worth of education there. So that has been very, very helpful for a lot of the PA students that I know that wanted to go into derm. I would ultimately like to create some type of a little residency after school, is after they've graduated, where they could commit maybe 6 months or something like that and learn in addition on the job, where it's general derm. We have such a need for it, and general derm incorporates so many problems, as you mentioned, that could be you see from a psychiatric or psychological standpoint, all the way to the family medicine, where they're coming in and saying, why do I have this rash and why am I in so much pain? And it's shingles or whatnot. And if you don't know you need to do a viral culture on it that very moment, by the time they get into a dermatology office 3 weeks later, if they're lucky at 3 weeks, the virus is gone. So having our colleagues in other specialties able to take a part is great. So that's one thing that I will say that Learn Skin and the DCIE program does really well. We allow you to come in, whether you're a family medicine, in family medicine, pediatrics, dermatology, acupuncture, whatever it is you do. We want you in there because we recognize that you are seeing skin and you are almost the gatekeeper, so to speak, or the first person that patient is coming to. And if you can provide them with service where they don't need to wait for an authorization or they don't need to make another appointment, then you can treat them right off. And our program is designed to give you the basics. So after you complete this program, you have something, again, you can add to your resume, as well as you end up with, I believe it's 25 CME category 1s. Not only that, but you network with a lot of dermatologists. So you have a chance of meeting derms that would be interested in bringing you on and training you.
Great.
That's
That's
all.
good
Yeah,
information.
Yeah.
absolutely.
Dr. Ross?
Well, Dr. Stern, this was so informative today. Everything that you're doing and all of the wonderful things you're really doing to advance our profession. We just want to say thank you so much for being here with us today. And I feel like we could go on and on about, all the wonderful things related to dermatology as well. So I think what we would do, we'd love to have you back for another episode in the future.
That would be awesome. I would love that. It's been an absolute pleasure being with the two of you as well, and all that you both do. Thank you for everything you're doing because it's working. I think we are really making a name for ourselves and our colleagues out there. And I think our future looks great. We've got a lot going on, and I think we're just going to see a lot more of us out there in positions where we're serving the community in ways maybe we didn't think about just 10 years ago.
Absolutely. Thank you.
Thank you so much.